The bartender says, "Why the long face?" All right, I was going to tell a pig joke, but I didn't want to be a ham. Who says Medicare can't be fun? My name is Dan Paterka, and I'm a member of the Hogue Senior Services team. I have a small agency in Newport. We have about 10 to 16 agents, and we can all help you with all of the plans that are discussed here today. Individual coverage. Medicare is for individuals. So even though Medicare may not be fun, what it can be is confusing, and so we try to diffuse that mystery and answer any questions that you may have for free. There's a lot to unpack today, so we'll just get started. A quick overview of what we're going to talk about, some general information, a quick summary of Medicare, then we're going to look at the individual parts of Medicare, and there are really only 4 of them as far as Medicare goes. There are entry points into the Medicare system, and they're known as election periods, so we're going to talk about a few of those, the main ones. We're going to talk about leaving employer coverage because that is one of the entry points when you leave employer coverage for getting into Medicare. And then we're going to go over coverage options, and I'll leave you with some contact information, and we'll field questions at that time. One of the issues with Medicare is that, that causes confusion anyway, is that Medicare uses different terms to mean exactly the same thing, and similar terms to mean completely different things. So we'll try to be clear as we're moving through this discussion today what we're talking about, so you'll know what people are talking about when they talk to you about Medicare. General information. You are considered to be a beneficiary under Medicare's rules. You've paid into a trust fund through your working career, and so when you become eligible for Medicare, that trust fund money is available to you. So you're considered to be a beneficiary. It's not talking about wills, trusts, or estates. It's just that you are receiving benefits under the Medicare system. Are you the only one getting all this mail? Well, you may think you've hit the jackpot, but that's not the case. There are lots of people trying to contact you right around this time of year. This is one of the entry points into the Medicare system, and so you'll be getting a lot of mail. I've gone to people's homes in 2019 BC before COVID, and they'll pull up an orange crate, would have done, and they'd say, "Hey Dan, of all this information that I'm getting, what of it do I really need?" And there are really only 2 agencies that you can trust to provide you with reliable, if sometimes vague, information. One of them is the Social Security Administration, and the other one we call Medicare. The government can print money, levy taxes, and abbreviate acronyms. In this instance, they've taken the Centers for Medicare and Medicaid Services, and they've abbreviated that to CMS. CMS is the agency that we call Medicare. So you can trust CMS to provide you with that information that you need. You want to keep any mail that you get from them, and you also want to keep any mail that you get from Social Security Administration, and I'll explain why in just a moment. Okay, so CMS is charged with the oversight and regulation of our industry, and they are there for your protection. They want to make sure that whether you are 65 or 105, no one is taking advantage of you. So we have rules in place where we can't buy you a dinner because you might feel obligated to buy a policy from us. So we can't call you at 6 in the morning and pressure you into buying a policy either. There are a lot of different rules in place, and one of them is called an SOA, a scope of appointment. And that's what comes up in the next item. So a little bit about sales agents and brokers. A sales agent is someone who works for an insurance carrier. They represent that company only, and so you're just getting that carrier's line of products. A broker is someone who works for you. We represent a number of different carriers, and so we can provide you with a broader range of choices. SOA is a scope of appointment. Whenever you meet with a broker on the telephone or an agent on the telephone, in home, in a library, sort of a one-on-one type of situation, not a group setting, but a one-on-one, they're going to ask you to sign what's called a scope of appointment, and it limits what they can talk to you about. You'll see a line on there and it will say beneficiary signature, and that's you. You are not an authorized representative. That is someone to whom you've given power of attorney. So don't be afraid of the form, the scope of appointment. It's standardized. And you can read through, and it tells you you're not giving up anything by signing this. You're just saying, I do want to talk to Dan about Medicare. And then it gives you options of the things that you want to talk about. So this prevents someone who sells long-term care or final expense or term insurance from talking to you about those things, because that's not what we're meeting, right? Okay, so that's the scope of appointment. Everyone gets paid, whether you go directly to the carrier or to an agent or a broker. The price to you is not going to be any different, though. So essentially, we do our services for free, and then we get paid by the insurance companies to represent them. So you don't have to pay anybody a fee. It's at no cost to you. We are licensed by the state, so we could lose our license if we do things incorrectly. And we're certified by the companies that we represent. Every year we have to go through an annual certification to make sure that we understand the products that we're representing to you. All right, what's Medicare? Well, it's health insurance for people that are 65 years of age and up. You could be under 65 with certain disabilities. If you have a disability for more than 2 years, you'll be put onto Medicare automatically after the 24-month period. You could also have end-stage renal disease, that's stage 4, where you're on dialysis. And if you do have stage 4 kidney disease, then Medicare will put you on after the 4th month of dialysis. The Social Security Administration is charged with the enrollment and billing of people into Medicare. So there are premiums associated with a couple of the parts of Medicare, and so they're in charge of billing you for those premiums. The Centers for Medicare and Medicaid Services, Medicare we call it, they're in charge of the rules and the plan designs. Below here you can see someone's Medicare card. It's a red, white, and blue card, and this person has both Part A and Part B. These two together are known as original, straight, or traditional Medicare. Medicare always starts on the 1st of a given month, and we'll talk about which month it is in a couple of slides here. Part A, so stepping off first, there are 4 parts and 4 parts only to Medicare, and they're lettered A through D. So Part A is hospital insurance. It's called by Medicare. I think of it as acute care. You're automatically entitled. This is the trust fund into which you've paid through your working career, and so Part A is set aside. It's really a catastrophic type of coverage, and we'll look at more at that in a second. Part B is called medical insurance by Medicare. I think of it as the basic stuff. It's day-to-day, primary care physicians, specialists, and all kinds of things like that, and we'll look at that more in a moment as well. You do not have to sign up for Part B if you don't want to, but you do have to pay for it. So if you don't sign up when you should, you may get a penalty, and that penalty will go with you for the rest of your life. So we really need to be careful with Part B. Part C, also called a Medicare Advantage or an MA plan, is an alternative to original Medicare, Parts A and B. Under Part C, you would receive all of the benefits that you get under A and B, and then they wrap in a few other things that make it kind of an attractive plan. So that's Part C, it's an alternative. Part D is subsidized access to drug insurance coverage. The types of drugs that you would get at, let's say, a retail establishment, CVS, Walmart, Walgreens, places like that, not what you would get in a doctor's office. Okay, so A, B, C, D. A little bit more about Part A. It includes a hospital stay, or any hospital stay actually. For that hospital stay, you're going to pay a deductible. The first $1,484 is going to be yours to give, and it extends for each time that you go to the hospital for something different. So if you go in January for gallbladder, June for an ankle fracture, and November for appendicitis, each time you're going to pay $1,484, close to $4,500 for that year. One of the problems, if you want to call it, with original Medicare, despite its virtues, is that there's no upper limit to the amount of money that you will pay under Medicare, original Medicare. Skilled nursing facilities included. After day 20, you'll start paying for it. Up to 20 days, Medicare will allow you to stay at no cost. I can't say free because that's against the rules, so at no cost, you can stay for 20 days. At a skilled nursing facility, they will allow you to stay for 100 days as long as you show continuous improvement. However, if you don't improve, they're going to send you home because Medicare doesn't offer you long-term care. That's considered to be something completely different and outside of the umbrella of what Medicare offers. So you have to show continuous improvement in a skilled nursing facility. It includes hospice if a doctor orders it, and home health care if a doctor orders it. It's far less expensive to take care of you at your house than to have you sitting in a hospital bed and occupying that space. It's just too expensive. So it's better to send a nurse around to change your dressing or give you an IV or something of that nature. It also, Part A, includes after the first 3 pints of blood. So you can see it's really a safety net. It's catastrophic coverage. For Part B, it includes, surprisingly, an ambulance ride to the hospital because it may or may not be a true emergency, and so an ambulance ride is covered under Part B. It includes doctor visits, outpatient hospital services like, let's say, a surgery, knee, shoulder, hip, that type of thing, labs and diagnostic tests, MRIs, CAT scans, things like that, and durable medical equipment, hospital beds, oxygen, things of that nature. Under Part B, you have a small deductible, and this amount changes every year. This year it's $203. They don't want you going to the doctor's office for a Band-Aid, and so there's that little speed bump in there that says, okay, $203 first, and then your benefits kick in. That's what a deductible does. So after you've paid the $203, it's an 80-20 split of Medicare's allowed amount. So let's say you go to a provider under Part B, and they want to charge $200 for the service. They send the bill to Medicare because you're a Medicare patient, and Medicare sends the bill back to them, and they say, hey, we only allow you to charge $100 for this service, and here's $80 from us, from Medicare. You can get the other $20 from Dan. That's that 80-20 split. Now, there are some providers under Medicare Part B that do not have a contract, a direct contract with Medicare, and they will tell you, I know the diagnostic codes for Medicare, and so I'm going to bill them for you. This is a favor I'm doing for you, and in return for that favor, I'm going to charge you an administrative fee, and that fee can be up to 15% over the allowed amount. So in the case of the provider that we were talking about before, you'd pay an extra $15 because the allowed amount is $100. So you'd be on the hook for $35, and Medicare would still pay its $80. Now that's not a big deal when we're talking about a $200 charge that's been reduced to $100, but there are only really 2 groups of doctors that I know of that will charge this Part B excess charge, and it is anesthesiologists and emergency room docs. And so you have to be really careful because I don't know what 15% of a lot is, but it's probably going to be a lot. Okay, so that is something that you need to be aware of. The $1,484, the $180.50 for the skilled nursing facility, the $203 annual deductible, 80-20 split, your 20%, and possible Part B excess charge. Now, for Part B, for all those good things, you're going to pay a premium, right? You've already paid into a trust fund for Part A. For Part B, you have to pay a premium. This year, it's $148.50 as a base. It is adjusted based on your income from 2 years ago, and that adjustment can boost your premium up to $504.90 per month. So it affects those people with incomes that are over $88,000 as an individual, but if you're married filing jointly, it doubles. It's $176,000. So they don't care who makes what in your family. They just take that income from the adjusted gross income line, they add back in tax-exempt interest, and then they divide that by 2. So Medicare is for individuals. It's an individual policy. So if your spouse is going to become eligible for Medicare first and you've got a few years lag, they're going to still take your income, divide it by 2, and say, okay, this is what you owe based on what we see here. Okay? The premium for Medicare will be deducted from your Social Security benefit, or if you're not drawing Social Security income, they will bill you every 3 months, and that bill will come from Social Security Administration. Okay, so that's Part B. Part C we talked about being an alternative to original Medicare, known as Medicare Advantage, or MA. And some of the Medicare Advantage plans include prescription drug coverage. So they call them MA plus PDs, MAPD. You have to continue to pay $148.50 for your Part B premium, so everybody needs to have that foundation, that A and B. They have to have original Medicare to go on to a Part C plan, because the C plans cover what you would have gotten under A and B. Medicare pays carriers to provide benefits to you, and you have to stay within a network of doctors and hospitals. Most of the Medicare Advantage plans, at least here in Orange County, are HMOs. You pick a primary care physician who coordinates your care and directs you to specialists if they think you need to see one. Primary care is always available in a specific geographic area. It's by county, but you always have worldwide emergent and urgent care. So what's the difference between emergent and urgent? Emergent is life-threatening. You think you're going to die. You've been in an auto accident, you have chest pain, things of that nature. Urgent care, you have an ear infection. It's not going to kill you, but you want to get it taken care of. You've cut your finger, you're on a blood thinner, and you can't get it to stop bleeding. Urgent care. Okay, so you always have those two things available with an Advantage plan. You would choose a plan based on benefits, cost sharing, and the network of doctors is particularly important. Your primary care physician is very important in guiding your care, so you want to choose that carefully. The benefits are really good, and most plans include pharmacy coverage. And when I say the benefits are good, they usually have what are called lifestyle benefits, which include vision, dental, over-the-counter benefits, as well as a gym membership. So, and there are many other lifestyle benefits that are included with an Advantage plan. Part D, this is coverage, like I said, for retail medications that you'd get on a regular basis, even, you know, amoxicillin if you're going to go in for a dental appointment. There are a number of different plans that are available every year. Every state has anywhere from 30 to 35. California has 32 this year. Medicare, because they're charged with the rules and benefits, the benefit packages that are available, they know exactly how much each of the prescription drug plans costs, the premiums. And so they take an average across the nation. It's a weighted average, but they take the average and they determine that this is going to be the basis for a penalty if you don't have Part D when you should. So the amount this year, the average cost is $33.06, and they use that as the basis. We'll look at what that could possibly mean in another slide. There's an income-related monthly adjustment amount, just like Part B, for prescription drug plan enrollees, and it's got the same 6 tiers as Part B does. So you could pay up to $77.10 for something that somebody else does not have an IRMA for. So with your IRMAs, if you're making over $750,000, you're going to pay $504.90 plus $77.10, which is $582, where someone else might just be paying $148.50. The monthly premiums for the Part D plans vary by the state, and they vary by what benefits you're looking for in the plan, as well as the medications that you're taking. So your agent or broker will help you to determine which plan is the best one for you on an annual basis, because the drug plans change every year a little bit. Mail order is available with most Part D plans, and a lot of the Medicare Advantage plans include Part D coverage. So entry points into the Medicare system. There are 4 main ones. They're not by any measure all of them, but they are the main ones. So the initial election period is when you're first turning 65. If you don't have any other insurance in place, like employer coverage, and we'll talk about that in just a second, if you don't have that, you need to sign up for Medicare when you're turning 65. This is a 7-month window of opportunity. It begins the 3 months before your birth month, the month of your birth, and the 3 months after. So if you sign up any time in the 3 months before your birth month, Medicare will start on the first day of your birth month. And that's why it's always the first of a given month. So let's say you're an April 19th baby and you want to sign up for Medicare early. You can sign up as early as January 1st. January, February, March. And then April 1st is when it will start. You can wait and sign up in April, and in April it'll start in May. If you sign up in May, it'll start in June. But if you sign up in June or July, the last 2 months of your April baby window, Medicare will delay your entry into the system. You will not get penalized because you've signed up within your window, but you will be delayed in getting your benefits. So our best advice to you is to just sign up when you, in the 3 months before, if you don't have anything else in place like employer coverage. There is a special election period. That is another type of entry point, and it's the biggest one is leaving employer coverage. Now, to maintain employer coverage, if you like it and you don't want to get into Medicare, there are 3 conditions that need to exist. The first one is that you have to be actively employed. So you can't be retired on COBRA, anything like that. Active employment. The second is that you have to be in the employer's plan. And this goes for a spouse as well. So if a spouse is Medicare eligible and they want to stay on the employer's plan and you're actively employed, that's fine. When you leave that employer's coverage, you're going to have to do some work, but you can stay on that employer's plan. Okay, so actively employed in the employer's coverage and employer group health plan. And then the last thing is there have to be more than 20 lives on that policy. So a small group plan is not going to work. An individual plan like from ACA, that will not work. If you're self-employed, that unless you have a big company, that's not going to work either. Okay, so we have to be really careful with that. That's the special election period. You can sign up for any of the parts of Medicare, A, B, C, and D. The annual election period, in which we're just about to enter, tomorrow is when it starts, when people can start releasing information, and so why you're going to see a lot of mail in the next few days. Actually, for the next 7 weeks, you will see a lot of mail. This is the time when you can change or choose a Part C plan or a Part D plan. The sign-up period is actually October 15th to December 7th, Pearl Harbor Day. If you sign up during that time frame, you can do it multiple times. You can go with Cigna on October 15th, Aetna on November 1st, and if you pick on December 7th, you went back to Cigna, then you'll start with Cigna on January 1st. So it's a lot like an employer coverage plan where you pick in the fall, it starts on January 1st. You're expected to maintain that policy throughout the calendar year, so till December 31st, and during that next year, so it would be plan year 2022, you would have another opportunity during the AEP, the annual election period, to pick a new plan. Okay, last main one is the general election period, and this is for Part B. Let's say that you forgot to sign up for Part B, or inadvertently you didn't do it. I had a fellow contact me on April 7th, and he said, "Hey Dan, I just got back from vacation. I've been on COBRA, and I was contacted by my COBRA company, and they told me I needed to sign up for Medicare." So I went into the Social Security Administration. Now this is a couple of years ago, of course, and they told me that I can go ahead and sign up for Part B, but I have to wait until January 1st of next year. Is that right? Yeah, that's true. You have to wait until January 1st. He said further, they told me that I have to wait until July 1st for the actual Part B insurance to start. Is that true? Yes. And he said, the last thing is that they told me that since I will be without insurance from April 7th, or actually March 31st, until July 1st of the following year, that is more than a year, and they're going to charge me a penalty. And that penalty will go with me for the rest of my life. Also true. So what we want to do is avoid this general election period if we can, okay? And your broker will help you manage it so that you have continuous coverage from the day you leave employer coverage until you get started on Medicare. So we'll make sure that you have continuity. Leaving employer group health plan. This is important information for any of you that are working after 65 or have a spouse who's working after 65. Individual plans are not employer coverage, so you need to get Part B. Even if you go on to COBRA, you need to get Part B within 8 months. Okay, if you don't do that, then you might be looking at the general election period, probably. So retiree plans, less than 20 people, and so on. Once you leave an employer's coverage, you're leaving the nest, and the employer's probably not going to allow you back in. I'd say with 98% certainty, the employer will not allow you back into the fold. Medicare is an individual plan. It's for you only. And so if you're thinking about taking your family onto Medicare, well, they all have to be 65 or older or have a disability. So you need to consider what's going to happen to your family when you leave that employer coverage. Some employers will say, well, if you're not working, I'm not going to have your family on here. And you'll go out into the ACA world, which can be quite pricey for some people, and have high deductibles. So we want to be careful with that as well. Of the 3 things that happen to us as we age, Hearing, dental, and vision are not covered by Medicare by law. So as long as you're standing upright, even if you can't see across the room, you're good to go according to Medicare. So Medicare doesn't really factor those things in. Some of the Medicare Advantage plans, the Part C plans, do take that into consideration, and it's part of their lifestyle benefits. But with original Medicare, you're going to have to figure out something else. Most often, it's more comfortable to stay on company COBRA, dental and vision, because you know that those policies will go to the people that you see already. Well, I guess one of the issues for leaving employer group plan is that you've had an HR director for years, and they've just said, here are your options. Now you're the HR director. You've got, you need some help, and that's why there are brokers like me available. If you're making HSA contributions after age 65, that is also a consideration, because Medicare, when you sign up for it eventually, they'll make your Medicare retroactive for 6 months. So you've been making contributions, and then you sign up for Medicare. The 6 months worth of contributions that you've made tax-free will now be taxed to you. So you have to be careful with that. Stop making the contributions 6 months ahead of when you decide to sign up for Medicare. Or it's not a penalty, it's just a reassessment of the tax-free status of those funds. So our best advice to you is be proactive, talk to your HR administrator, and check all of them, all of these issues. If you leave employer coverage after age 65, you will need to fill some forms out for Social Security Administration. One of them is, hey, I want Part B, and the other one is, here's why I didn't have Part B. Don't put me into the general enrollment period. To avoid the Part B 10% per year penalty, you'd sign up within 8 months after leaving employer coverage. Okay, so that's when you actually terminate your employment. You have 8 months within which to decide. Now, you're not going to go that long, because 8 months without insurance is probably not a good idea, but I'm an insurance person. So then the Part D is 12% per year. So you need to sign up within 63 days after employment ends. So the best thing for you to do is to just do everything within 63 days and you'll be done. But again, if you're working with a broker, they'll get you set up so that you have continuous coverage. After you get Parts A and B, remember those are your foundation, original, straight, and traditional Medicare. You choose one of 3 ways to use your Medicare. You can stick with original Medicare, but it does not include prescription drug coverage, so you need to get one. It's fee for service. You go to a doctor's office, he bills Medicare for that particular service, and you're good to go. You pay your 20%, maybe Part B excess charge. But there are gaps in the original Medicare plan, and we talked about all of those. The hospital deductible, the 203, 20%, 15%. So the other 2 plans can really fill in those gaps. One of them is known as a Medigap plan or a supplement. This supplement is a very specific term in our industry, and it refers to this. Now, the problem with supplements is that they are also lettered. But if it helps to make a distinction between the parts of Medicare, A, B, C, D, and the plans of Medigap, supplement plans, they are plans and parts. Parts of Medicare, plans, Plan A, B, C, D. The gold standard these days, if you're turning 65, is one known as the G plan. The G plan will cover all of those gaps that we talked about in Medicare, except for one thing. That one thing is the Part B deductible. This year, it's $203. So it's not bad. It's a really good comprehensive plan. The more comprehensive the plans are, the more expensive they are. So the G plan is going to be more expensive than one of the other letters. There is a matrix that we can provide to you that kind of describes what the different benefits are under the plans, but the G plan is probably the most popular one because it's almost a set and forget. You pay your premium, and then the premium is in addition to the Part B premium. But once you pay that premium, everything is kind of covered. There are various coverage levels, and they range from letters A to N. Medicare Advantage plans, Part C of Medicare, the government contracts with an insurance carrier to provide benefits to you. The insurance carriers get paid on a monthly basis, and that payment is based on their star rating. Medicare rates each insurance company on how well they do, whatever it is that Medicare wants them to do every year. And so every year they get a new star rating, and they may get more money based on being a 4.5-star plan out of 5, 5 stars is the best you can do. So 4.5-star plan is good. 4 stars, anything above 3 stars is really an adequate plan. You pick a primary care physician, and then you get all the benefits of Medicare that you would have gotten under A and B. Most often includes prescription drug coverage. So this is an infographic of the same thing, but I liked it because I made it, number one. And then number two is I think it makes it easier to picture it. So you've got original Medicare, A and B. You need a separate prescription drug plan. You can add in a supplement if you'd like, but the supplement is going to cost you some money, right? But it does fill in the gaps for Medicare. You still need a separate prescription drug plan, which also costs money. So you're really, with original Medicare and a supplement, doing an a la carte meal. You've got your hamburger, your French fries, and a chocolate shake, okay? But you pay separately for each of those. When you go to Medicare Advantage plan, which is option 2 really, then it's an all-inclusive plan. So all the benefits that you have under A and B usually includes prescription drug coverage and the lifestyle benefits. So that can work for you as well. All right, a little bit more about Medicare supplement plans. I promise you we're almost done. You can get care from any doctor that accepts Medicare assignment. So this is an incredibly flexible plan. With original Medicare, you can see Dr. Seth in Cabot Cove. You can see Dr. Gray in Seattle or Dr. Jones in Newport, as long as all of those doctors accept Medicare or will bill Medicare for you. There are monthly premiums with the supplement plans, and they range, but the plans are standardized. So a G plan is a G. It offers the same benefits whether you're with Aetna, United Healthcare, Blue Shield, Scan, not Scan, they don't offer a supplement, silly me. And so they all offer the same benefits no matter where you go. The supplement premiums in addition to that base premium for Part B. And then when people look at a supplement plan, they consider 3 things. The first thing is, how much is it going to cost me? So if a G plan is a G plan, if it offers the same benefits, why wouldn't I just go with the cheapest one? Well, reputation. Do you like that company? Do you know of that company? This company treated my mom really well when she was ill, and I'm going to just stick with them. I really like it. Okay, so there's cost, there's reputation, and the last thing is underwriting, which is a series of medical questions that a carrier will ask you to determine whether or not you're a good risk for them. Some people have asked me, Dan, there are no pre-existing conditions anymore, right? That's not quite true. In the Medicare world, there are pre-existing conditions because, again, these are individual policies, and so the carriers want to make sure that you're a good risk. Now, they can't ask you these questions if you're within a certain window, and that is within, the window is within 6 months of obtaining Part B. They cannot ask the questions. And so you have sort of a free pass to get in. If you can crawl into Medicare, then you'll get a supplement plan. They're portable. You can go anywhere you want. So these are very nice for snowbirds, people who have a home on 2 coasts, or happy wanderers. You know, you want to hop in your RV and go visit your grandkids in the several states that they live, and you can do that with this portable Medicare supplement plan, because Medicare extends across the United States, and so just it supplements the Medicare. You do need a separate prescription drug plan with a supplement as well. So, important points to remember. You don't have to enroll in Medicare Part B or Part D if you have employer coverage. A and B exclude pharmacy coverage, so you need to get a Part D plan if you're just going to get original Medicare. A and B alone leave you exposed to unlimited out-of-pocket costs. You know, there's no upper limit, but there are options to obtain additional coverage. We at Paterka Insurance offer all of these options to you. All of my agents do. The entire team. Higher income beneficiaries will pay more for Parts B and D. And we talked about that, Irma. You can make changes to your plan choices every year during the AEP. And in California, you can make changes to your supplement insurance in your birth month. They call it the California birthday rule. Leaving employer coverage warrants additional advice and consideration, and we offer this advice at no cost, as well as, you know, any help filling out applications and things of that nature. So this is my contact information. We are going to open up the floor for any questions that you might have that might not have been answered already in the chat box, which I forgot to mention.
One of the questions is, I'm not drawn from Social Security, so how often will I get billed?
Okay, so this person is not drawing from Social Security, not getting Social Security income yet. So that person will be billed every 3 months. It'll be on a quarterly basis. There may be a true-up to get you on the same basis as everybody else, the same quarter basis. So the true-up may involve an extra month. There are many different ways to pay your premium these days. You can do it now with a credit card as well, from what I understand. So lots of flexibility in how you pay if you're not drawing Social Security.
The question is, when they call in for a consultation, is it confidential?
Yes, all our consultations are confidential. One of the rules for Medicare is that we safeguard your information. So there are electronic forms. We keep paper, but it's all locked up all the time. So yeah, it's confidential.
So repeat the question when I ask you. Do your premiums change if your income goes up or down over the years?
Do your premiums change if your income goes up or down over the years? They do. They should. But you have to be an advocate for yourself. If your income changes, or let's say you had a one-time thing that happened, you sold some income-producing property, so you had a bump in your income, you can file an appeal form called an SSA 44, and it will allow Medicare to reconsider the assessment, the income-related adjustment. So that's always possible. Many people will work a lot before they retire to pay off their house. They might take some money out of their 401k, so that affects that AGI line as well. And so there is a remedy available, and we can help you with that as well.
Have you come across a client that gets billed monthly for the Medicare Part D premium? They're not drawing from Social Security.
Have I ever come across a client who gets billed monthly for their Medicare premium and they're not drawing Social Security? I have not. Okay. So thank you for joining us today. Look forward to helping you with your Medicare if you need it. Have a great evening.